Hey, are you dealing with neck problems? And have you had your neck checked out and been told by a doctor that you've got cervical stenosis or stenosis in your neck? You might have had an x-ray or an MRI that showed that you had cervical stenosis, or you might just think that you might have cervical stenosis because maybe your dad or your mom had it or some other relative, and it could run in the family. Oftentimes, when we see clients here in the clinic that have been diagnosed with cervical stenosis, they are terrified by those words. And when they look at their MRI report and they see a bunch of other huge medical terms like degeneration and arthritis, it just freaks them out. And oftentimes, doctors are kind of quick to throw the surgery word out there. They say something like, people with cervical stenosis might end up having surgery someday. But the truth is, cervical stenosis is very manageable in most cases, and it does not have to be scary. In this video today, I'm going to explain to you exactly what it is, the different types of cervical stenosis, and why it happens in people. And so that way you can learn how it's possible to begin to fix your cervical stenosis problem naturally without surgeries. My name is Dr. David Minoff, and I'm a specialist physical therapist at El Paso Manual Physical Therapy. And this channel specializes in helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Be sure to subscribe to our channel so that you don't miss out on any of the helpful videos that we put out every single week. Now let's get to it. There's two types of cervical stenosis. One is called central stenosis, and the other one is called foraminal or also lateral stenosis. You have foraminal stenosis or lateral stenosis. Same thing, they just have different words for the same thing. That's the medical field for you. So let me explain the difference here. Central stenosis, the first one, let me get a picture to show you what I mean here. So I've written out this nice little fantastic drawing. I appreciate my artsmanship. It's terrible. But here's a side view of the head and the neck, and you have 7 neck bones right here. And then in green here, you have the brain and the spinal cord coming down. Same thing over here, but we're looking at a zoomed in top to bottom view of one level of the spine in the neck. So here's the disc, here's part of the bone in the back that comes to the point. And then here in the middle, you've got your spinal cord and you have nerve roots that go out to the side. In central stenosis, the problem is here in the middle of the spinal cord. You get some compression that's coming from the bones or the disc or something over there. Stenosis just means that an opening is getting closed or pinched off. So in central stenosis, the central part of the nerves here are getting pinched. So the spinal cord itself is getting pinched. So that's central stenosis for you. Now in lateral, or also known as foraminal stenosis, what they're talking about is the pinching happening out to the sides. So lateral means sides. Foraminal just means the holes in the sides of the spine where the nerve roots come out. So you get some pinching out here on a particular side. They might tell you have more on the left or more on the right, or some cases both. So here in the spinal cord, you might get that, like that red dot right there is an example of some pressure on the spinal cord or on the nerve root that comes out to the side. Now, you might be thinking, well, which one is worse? They can both be bad. I mean, if for central stenosis, the big concern is that if there's enough pressure on the spinal cord, it can begin to affect the legs. It can begin to affect your bowel and bladder function, meaning your ability to hold it in, hold in pee or poop. And if the nerves get compressed enough, then you can start having accidents. And that's a big concern, by the way. If you're watching this video and you think you might have cervical stenosis or you've been diagnosed with cervical stenosis, what you need to know is that if you're having accidents, like you're not making it to the bathroom in time and you're dirtying yourself or wetting yourself, or this is if it's changed, because you might say, oh, well, that's been happening for a while, actually, before my neck pain came on. But if you've had an increase in neck pain and also simultaneously had an increase in accidents, or you've been dirtying yourself, then that's a serious concern, and you need to stop this video right now and call an ambulance. I'm not even joking. Put your phone down or switch to your phone app if you're on your phone and call 911 and get yourself to a hospital if you haven't already been checked out. And if you have and they said it wasn't that bad and you started getting these accidents happening, you need to go to the hospital And you very well might need a surgery, which is, it's good to catch it sooner rather than later because you can have some permanent damage. But that being said, that situation is rare. It is super rare. What's more likely to happen is you get some numbness and tingling, some pain, some weakness that might happen in your arms or legs because of this cervical stenosis. That happens the most. That's what we see here the most here in the clinic whenever there's a central stenosis issue. Now, when you have lateral or foraminal stenosis, the nerve root is being pinched, and it typically shows up on an individual as pain in the neck, of course. Then it might go down an arm. You might get some numbness in some fingers or part of your hand. You might get weakness, like you're dropping things, dropping your keys, having trouble turning knobs, opening jars. Or it could even affect the leg in some cases, depending on the situation. But if you're talking the neck, it's most often going to affect an arm on one side. And it's usually one-sided. Sometimes with all these diagnoses, there's multiple diagnoses that overlap. So they might also say that you have cervical radiculopathy, big words for the nerve root is getting pinched. Now, if we're talking about the stenosis, we're talking about several reasons that it could occur. So let me go into that next. There's 4 reasons why you could get stenosis. The most common one is definitely a disc herniation in your neck. So between every single level of the spine, starting with the neck bones up top, that's part of your spine, you have discs, which are squishier cartilage-based structures that allows for some movement between the bones. If you've got some long-standing muscle imbalances or other issues, or maybe accidents have accumulated over the years, over the decades, you might end up having a disc herniation. And truth be told, disc herniations happen anyway as we age, and it doesn't mean that it's a bad thing. It's part of aging. It's kind of like getting gray hairs and wrinkles. So if you've ever had an x-ray, really an MRI, and they've looked at your discs and told you have disc herniations, it's not the end of the world. If it gets bad enough that it's pressing on a nerve, then we have to do something about that so that it doesn't get worse and you don't end up in a situation where you have to have a surgery. It's salvageable most of the time. The second most common reason is arthritis in your neck. If you've got joints in your neck that are starting to get stuck and not moving too well, and that happens for weeks, months, and years, the surfaces within the joints, there's cartilage, there's movement that's supposed to be happening there. It gets kind of rough and the movement doesn't happen as it should. And because those joints are right next door to where the holes where the nerves come out, it can start to affect the position of the joint, which starts to compress the hole a bit, which pinches the nerve and can cause this lateral stenosis, the foraminal stenosis problem. The third most common reason for getting stenosis is chronic bad posture. I mean, if you're in your 40s, 50s, 60s, 70s, or beyond, and you can admit that you've probably had bad posture that whole time, then there's a good chance that that posture, whenever, especially if you're this slumped forward posture with your head kind of tipped up, it closes the holes. The more you look up, even if it's just subtle, you subtly close the holes on the sides of your neck bones where the nerves come out. Those are called the foramina. Those foramen or foramina start to close, and if you have arthritis on top of that and you've got a disc herniation on top of that, you're gonna get some stenosis on those foramen, on those holes on the sides, and you might pinch some nerves. The fourth most common reason, and really the biggest one in my opinion, being a specialist physical therapist, and this is one that the MRI won't find. This is something that an expert might find, or somebody who's knowledgeable about this. Like if you've been keeping up with our videos, you'll probably know about this. Muscle imbalances. Anytime you move, if you turn your head, if you look up, look down, if you tip your head, the everyday movements that you have to go through where your head moves, those holes on the sides of your spine and the hole on the inside of the spine where your spinal cord goes through, they also move, and they slightly open and slightly close, and they grow in size, and they shift in order for you to do your everyday movements. And so the nerves that are within those holes have to have adequate space to move around. Now, if you've got muscle imbalances, and one of the most common ones in the neck area is where these muscles up here are too weak, the upper traps. When they're very weak, the shoulders start to slump down. And if this goes on for months, years, and decades, because of their attachment to the neck bones, they can start to compress the neck bones on top of each other. It starts to yank them down. And on the sides where the holes are, those holes can start getting smaller, the foramen, and over time, you can get that arthritis, the stenosis, the pinched nerves, the radiculopathy, all those different diagnoses that somebody gets scared at when they're looking at their MRI. And all that needs to happen is getting those muscles stronger so that we take pressure off the bones, joints, discs, and the nerves. And this, even though your diagnosis of stenosis is there, you get better. We have patients all the time that get better despite having that diagnosis of stenosis and the doctor telling them they might need surgery, simply by fixing the muscle imbalances and freeing up the joints and talking a bit about posture and calming down that arthritis problem they're dealing with. Now, if you're looking for how to begin to fix a stenosis problem, I've got a video for you linked here in the description, and it's called the top 5 ways to keep a cervical stenosis problem from getting worse and avoiding surgery. Go check that video out. There's some exercises and tips in there for you. This video here today is intended to show you just what it is, explain it so that you have an understanding and so that you're not afraid of it, because that's the biggest problem that I see with patients here in the clinic is they get that diagnosis and they're just scared that they're going to have a surgery someday. Not the case. I want you to have confidence that it can get better naturally without surgery. Occasionally you need to be on some medications shortly so that you can get through exercise. But a lot of our patients don't even need that. They don't need to be getting injections on a regular basis. It's possible to fix this and move on with your life, be healthy, active, and mobile, and never be relying on any medical interventions or medications. Hey, if you thought this video was helpful, please give us a like. Don't forget to subscribe and turn on your notifications so that you can get notified whenever we release our weekly videos. And drop a comment. Let us know if you've had cervical stenosis for a while and have been able to avoid surgery, because I know you're out there. Leave us a comment. There's people that are going to watch this video that they had that diagnosis, they had the MRI, and they're scared. And prove it to them, guys. Drop a comment on here and let us know that you have not had surgery. And now there's a lot of people that have listened to doctors' advice way too quick and gotten into the surgical room and have had surgery for stenosis. And some have had a good result. It's been very important for them. There are definitely situations where surgery is indicated. If your arm is just constantly asleep, in pain, you have some massive weakness, yeah, go get surgery, please. You probably need it. But if you don't have it, if it's more of an occasional pain, it can come and go, it can be influenced by motion, there are things that make it better, then you've got a great chance at getting better. And chances are you might not need the surgery. And there's people out there that have had this surgery. They've had a surgery where they rotor-rooter the spine, essentially. They clean out the edges of the hole to make it bigger, to allow more space for the nerve, or they go in and clip the disc. That's another one, a discectomy. And they end up worse sometimes. And it's really an unnecessary surgery in many cases. So just be careful, get a second opinion, do your due diligence, and make sure that a surgery is right for you before you pull the trigger, because this particular diagnosis can get better without surgery. Hey guys, I hope this video was helpful, and we'll talk to you next time. Be safe, stay healthy. Bye-bye.